My name is Jenny Owens. I'm an occupational therapist at Fort Campbell Army Post, and I work with service members who have mild traumatic brain injury and post-traumatic stress disorder. I did not have a student on site, but I did provide expertise as an expert mentor on cognitive rehab. As a mentor, my responsibilities were to assist the student in formulating her plan, give her guidance on specifically, she was doing some research, so I helped her identify some research questions. I read over all the materials as she was writing them, gave her feedback, and just kind of overall was just a supporter and a cheerleader throughout that process. I feel like her project, I'll give you a little bit of information on it. She worked on identifying assistive technology for cognitive rehab, and she did a needs analysis of occupational therapists working in cognitive rehab to kind of figure out what was their view of assistive technology and how did they integrate it into their practice, what were their needs. And in doing so, I think she also helped identify what would be needed to assist the patient populations as well. And she focused in on the mild traumatic brain injury and PTSD populations that our service members are coming back from war with, kind of figuring out how that's going to change the practice of cognitive rehab and occupational therapy. If I could talk to anyone who's considering being a student or an expert mentor, I would just say that this has been an excellent experience that's really taken the knowledge level in the student from just an understanding from a book or a clinical perspective, but really bringing it to the advanced level of integrating it, of information analysis, of really figuring out the needs of the community and trying to meet those needs in a way that sets her and the occupational therapy field apart from other fields. As an expert mentor, I gained greatly from this experience. Learning through her, she was an excellent researcher and brought a lot of good things to my clinical practice in terms of evidence-based methods. I grew through the relationship. I think she learned a lot through self-discovery, and I think that the long-term impact of this experience is going to make her a better provider, and it's going to help impact the populations that need to know these things, which is both the occupational therapists and the patients with cognitive deficits.